Alright, let's talk about common peroneal nerve injury, which is basically one of the nerve that is quite extensively tested on the exam and is also very common. So we will first go through the root, then we will see its motor supply and its sensory supply to make sure that you get all of them together. So basically it's a branch of sciatic nerve. So sciatic nerve, after coming down in the leg, on the back of the legs, winding around the upper thigh, and then it goes down in the popliteal fossa, it divides into the posterior tibial nerve, and then there is common fibular nerve, or which is also called as common peroneal nerve. So this then winds it out. If you look at the front, so this is the front, this is the back, so it winds around the neck of the fibula, and then it comes here. So since here it is very superficially located, so this is a very common site of the peroneal nerve injury. It can happen when there is the fracture of this fibula, anything hitting here, or even if you are sitting for a very long time cross leg, so that can also cause a bit of damage to this nerve. So since it's very superficial location, and it's winding around the bone, that is why it is very extensively damaged here, and that can lead to potential consequences. So once it winds around here, it then divides into deep peroneal nerves and in the superficial peroneal nerve. So again, then they run downward in the leg. The anterior or the deep peroneal nerve runs in the middle, whereas the superficial one runs a bit to the lateral side. So now let's talk about the various different muscles that it supplies, since winds around from the back to the front, and so hence it's mostly supplied the muscle in the lateral compartment as well as in the anterior compartment. So what will happen is that you will lose, so if this nerve is damaged, you will lose your ability to dorsiflex your leg. So you will have very weak dorsiflexion, and there will be weak foot eversion. So eversion is basically moving the foot in the lateral direction. If you try to evert your foot in this direction, so that ability will be lost, because this is the nerve that supplies the lateral compartment muscle and the anterior compartment muscles. And of course, as with any lower motor neuron injury, you will have the muscle weakness, because the muscles aren't supplied by the nerve, they aren't used much. Also, these nerves supply the lateral as well as the anterior part of the cutaneous supply of the leg. So in case of the common peroneal nerve injury, you will also find loss of sensation over the lateral as well as the anterior compartment. So that is all about the common peroneal nerve injury. It's a branch of sciatic nerve winding up around the neck of the fibula, where it is commonly injured, leads to the weak dorsiflexion as well as weak eversion, as well as loss of sensation over the anterior as well as lateral part of the lower leg. So that will be all about common peroneal nerve injury.